Regina Lewvan.
Thank you, Mr. Speaker, and I'd like to thank my colleague from Rimouski for his trenchant critique of this omnibus budget bill. I'm sure he also remembers that the current government was elected promising a new health accord, yet this budget does not provide any increase in federal transfers to provincial governments, either as a share of the economy or relative to previous projections. In fact, by 2019-20, this budget will have reduced annual transfers to provinces by $1 billion. To be specific, if we look at Table 5.2.6 in Budget 2015, it showed major transfers to other levels of government of $76.3 billion in 2019-20. Whereas if we look at Table A1.4 in Budget 2016, it shows this same figure down to $75.4 billion again in 2019-2020. So I wonder if the member for Rimouski could comment on why the Liberal government is cutting health transfers to Canadian provinces.
The honourable member for Rimouski, Nejet Temiscouata, Les Basques.
Thanks for my colleague from Regina Lewvan.
Well, this is a very important question, and it goes to the heart of Canadians' expectations based on the last election. On this side of the House, well, the NDP, we made clear commitments to re-establish the escalator for health care transfers to the provinces at 6%. And what the Conservatives proposed limited increases to the level of cost of living. That's not enough for the provinces, it's clear. The provinces need those transfers to face increased pressure on the healthcare system because with the aging population, well, the problem here is that the Liberal government says that it's going to negotiate a new health accord. They're talking about negotiating and not imposing. And in this budget, what do we find? Well, nothing that shows an increase in health care transfers. These negotiations won't be easy because we can't just look at the current situation in the provinces, but what's going to be happening in 5, 10, 15 years when there's going to be increased demographic pressure. What are the government's plans? Well, we have no idea. The budget and the Budget Implementation Act would have been the ideal moment to learn more about the government's plans, which are very nebulous at the present moment.
The honourable member for
the honourable member for Regina Lewvan.
Thank you, Mr. Speaker. The Liberals ran on the idea of a new health accord, and yet this budget does not include any increase at all in the Canada Health transfer. In fact, if you compare Budget 2016 to Budget 2015, what we find is that projected transfers to provincial governments are actually lower now than they had been under the previous Conservative government. Indeed, by 2019-20, the Canada Health transfer will be $600 million lower under Budget 2016 than it would have been under Budget 2015. And if we look at overall transfers, they're about $1 billion lower again by 2019-2020. So I wonder, Mr. Speaker, if the Honourable Parliamentary Secretary could explain to us why his government is cutting transfer payments to the provinces.
The Honourable Parliamentary Secretary.
Mr. Speaker, I'd like to thank the honourable member for his question, for whom I have a lot of respect and I've known for a long time. We did a number of things in public policy together before. Mr. Speaker, I can only invite the member to look at the budget. I'm quite happy to answer that question. Actually, I wish that would have been asked that question because we have made historical investment in health transfer, Mr. Speaker, $36.1 billion in health transfer. That's the historic high in this country in terms of investment. So obviously, we do take health as a very serious matter. I'm happy to see that my colleague, the Minister of Health, is negotiating the next health accord. But I can say for this House, $36.1 billion, Mr. Speaker, this is a fact. This is the historical high investment in terms of health transfer in this country.